Okay. Good evening, everyone, and a very warm welcome. I am Catalina Grija. I'll be the host for this powerful webinar with Dr. Grace Hula and Dr. Zoltan Nagy. I'm delighted you're here, truly, to meet you and also congratulate you for investing time in yourself. And I am based in Chicago, so for me it's afternoon, early afternoon. So I'm getting used to saying good evening. But let me ask you something, and I want you to really sit with this. When was the last time you truly felt great, like you? So not the version of you that performs, serves everybody else, fixes, holds everything together. I mean, the you who feels clear, energized, peaceful, connected, healthy, in control of your life. Because what we're seeing right now is that over 70% of high achieving people are burnt out. And a lot of them are women. And almost all of them are told, oh, it's just aging, it's stress, it's menopause. But yet, when you're laying awake at night and thinking, oh, all my tests are normal, why don't I feel great? Well, the truth is that your labs can look normal for years while your body's falling apart beneath the surface. And you know it. You feel something's wrong, but you don't know what to do. And that's why what we're doing today is totally different. We're not guessing, we're not dismissing your symptoms, we're not waiting, and we're not handing you another generic explanation. Today is about your life, your dream, your purpose, your energy level, your health, your inflammation level, your longevity. Because when you combine transformational work with testing that shines a light in every corner of your body, you'll finally get the whole truth. So you are in the right place if you've been looking for a solution for what you're feeling. So it helps a lot if you put your cameras on, if it is safe, of course, and if it's possible, because that's when we connect the best and when you can learn the most. You can absorb the information that you will be getting here. So type me in the chat if you're ready to really understand what's been happening under the surface. You've taken time out of your day to invest in your well-being, your clarity, and your vision. And that already tells me something important about you. You're someone who is ready for change. So as we begin, I love for you to pop into the chat where you're joining us from. Let's get to know our community. Anyone? Sheffield. Anywhere else?
Derbyshire.
London. Okay, London. Great. I love London. I have not been to Sheffield or Derbyshire, but next year, looking forward to that. Super. Thank you for being here. Thank you for being here. So my role is very simple tonight. I'm here to guide you to hold the place, elevate your energy, help you really receive every ounce of value from today's masterclass with the incredible Dr. Grace Hula. And before she takes the stage, I want to help you open your mind so that the insights that you hear today can actually land and create real change. Let me tell you a little story. There was this fly who was desperately trying to escape through a closed window. And it was giving everything it had: force, effort, determination. Yet the harder it worked, the more stuck it became, more tired. And just a few feet away, an open door. So if the fly would have seen that open door, it would have led her to freedom. But the fly did not. And it died with tremendous effort, but the wrong strategy. And this is how many people approach their health and their life. They try harder. They think working harder, trying harder is, going to provide the solution, but they don't try differently. So today we are opening the door. If that resonates, pop a yes in the chat. Thank you. Yeah, absolutely. Your thinking is the first domino. I learned this as a transformational life coach and a physician. Shift your thinking, your habits will shift. Shift your habits, your life will shift. Shift your life, your health definitely transforms. So this is not just information, it's identity. So before we begin today's masterclass, we'd like to share some stories from people who have experienced life-changing transformations through Dr. Hula's work. And these are not just before and afters. They're people who really reclaim their future. Let's roll the reel.
Zarika, Timo's video.
One second, please.
Okay.
My name is Moy. I am a full-time athlete, martial arts, Muay Thai, and kickboxing. My holistic medicine journey began about a year and a half ago. So I started with IV treatment for vitamin D because I knew I was vitamin D deficient. But as I started going for IV treatment, I also knew that I wasn't sleeping that well. I knew that there was a few stones uncovered when it came to my fitness. So I got the full comprehensive test done, metabolic test, seeing where I was deficient, and turned out I had certain deficiencies when it came to gut health, and also nutrient deficiencies. And once Dr. Grace put me on a treatment plan, everything sorted. So for me personally, I train 4 to 5 times a week. My training catapulted. My personal best records were all hits within the past year. So my body feels great. I've been sleeping wonderfully. Connected. It's probably the best investment I've ever done. Through an investment in myself. It helps that everything's so tailored to my own personal needs. And I could not be happier. Thank you. Thank you.
Powerful, isn't it?
Yeah.
Acknowledging that he could not have made a better investment in himself. And it's true. The best investment we can make is in ourselves. Learning from the most powerful investors in the world, right? Like Warren Buffett. So today we're going to learn the very system behind that kind of transformation. So before we transition into the actual subjects here, let me ask you something. What's one area, and let's drop in the chat, one area in your well-being that you're thinking if it changed would change everything for you? So what's the biggest problem right now? Is it energy? Is it weight? Is it confidence? Is it sleep? Is it stress? Is it fatigue? All of the above? Pop it in the chat. Attitude, stress. What else? Eating habits. Super. Well, you're right where you need to be. So before I bring in Dr. Hula, whenever something resonates today, just type an aha or yes in the chat. That helps your brain kind of encode the insight and absorb that knowledge. It helps the energy rise and it helps you stay present. So you'll hear from someone extraordinary, someone that has changed hundreds of lives across UK, someone who will show you the blueprint that can change yours. But before I bring her in, one more story to put it into perspectives. You know, there are two kinds of people in life. Turtles, who see only what's right in front of them, and giraffes, who see from a higher vantage point. When a giraffe actually lowers its head towards the ground, towards the turtle height, it cuts off its oxygen because it has such a huge heart. And it cuts off the oxygen and it suffocates it, can pass out. So it suffocates its own vision. So some of you are giraffes surrounded by turtles, people who love you, care about you, but simply cannot see the future you're trying to create. They cannot tell what's really best for you. So today is about stepping back into that height and rising. So if that resonates, type rise in the chat. So it's my honor here and joy to introduce the woman whose story and system changed not only her own life, but the lives of so many others. A pioneer in root cause healing, a leader in full spectrum health, and the founder of this life-changing program. Please welcome Dr. Grace Hula.
Thank
Take
you.
it away.
Thank you, Dr. Catalina. Thank you so much for the lovely introduction and for setting the scene. I'm really enjoying your stories. So I just want to, I'm just going to read how I got into functional medicine. My background is I'm a general practitioner based in the UK, and I've been a general practitioner for more than 20 years. And I was working long hours in a busy clinic, seeing patient after patient, often with only 10, 15 minutes appointments. My days were packed back to back with back-to-back consultations. And I was working into the night and feeling like I was constantly running on empty. I felt like I was on autopilot, prescribing medications, ordering tests, managing symptoms, but never getting to the root cause of the problem. Patients would come back with the same issues, and I started to feel like I wasn't really helping them. I'll never forget one patient came to me in tears, frustrated by years of chronic fatigue and digestive issues. Despite all the tests I ordered, I couldn't give her real answers. I knew there had to be a better way, but I felt powerless as the system I was working in could not provide the answers. So I started to feel trapped, like I was stuck in a system that prioritized quick fixes over true healing. So every day I would question whether I was making a difference, and it was exhausting, and I was starting to feel like I wasn't really living up to my full purpose. So one night, desperate for answers, I stumbled across a podcast about functional medicine, and that's when everything changed. They talked about healing the body as a whole, addressing the root causes of illness, and empowering patients to take control of their health. It was like I had finally found the missing piece I had been searching for. That moment ignited something inside me, and I knew I had to learn more. So I went on to train as a functional medicine practitioner, diving deep into the principles of root cause healing. It wasn't an easy journey, but it was the most rewarding one of my life. Now, several years later, I've helped hundreds of people transform their lives. I've seen patients break free from chronic symptoms, regain their energy, and rediscover joy in their lives. Functional medicine not only gave me the tools, but to make a difference, it gave me back my purpose. I finally feel like I'm living the reason I became a healthcare professional in the first place. So that night, something shifted, and I realized I had to start practicing prevention. And that's when everything fell into pieces. And that's how I ended up becoming a functional medicine practitioner. So it's never too late to change. Even after years of practicing as a general practitioner, you know, you can still move things. We continue to learn. Part of the medical oath is to continue learning, continue broadening our knowledge, help as best as we can, wherever we can. So that's my story of how I started doing functional medicine.
Wow. Thank you, Grace. Thank you so much for sharing that.
Thank you. So now I'm going to ask again, as Dr. Catalina already asked, some questions that you need to ask yourselves. Is this you? Do you wake up tired no matter how much you sleep? Does your body feel achy, inflamed, and stiff? Does losing weight feel impossible? And do you struggle with daily digestive problems? Stress, anxiety, sleepless nights leave you feeling stuck. Menopause, hormonal shifts are throwing your body out of balance. If it sounds like you don't have to feel like this anymore, because when you go through the system that I'm going to talk about later on, then you get the life that you deserve. So people who've gone through the system, they wake up or imagine waking up feeling refreshed, full of energy, moving freely without pain or stiffness, maintaining your ideal weight without crash diets, sleeping deeply, waking up clear-headed, feeling calm, focused, and in control of your body and of every stage of your life. This is very possible, and it can start today. It's up to you to make the change. So that's my quick message about food for thought if you want to make change or if you want to be stuck in your own ways.
Take a deep breath and feel that for a moment. Really feel it, like that contrast between how it was and how it can be, how it was for so many people, because this could be you. And it's so powerful because it's true. Most people live in a health hell far longer, or I mean, nobody should live in a health hell ever, but they do far longer than they need to, not because they lack the desire, but they lack the awareness and they lack a system. So back to you, Dr. Hula.
Yeah. So there are two types of people. There's the struggling survivor, and then there is the empowered healer. So the struggling survivor, they will not adopt any other programs. They're stuck in their ways, and they avoid committing to any new programs or systems that will help them. They're easily overwhelmed, and their mindset is that this is how life is. I'm too busy, I'm too tired, I'm too far gone. They prioritize short-term convenience over long-term health and belief. They continue relying on quick fixes, medications, fad diets, and they mask their symptoms. So they remain fatigued, stressed, and in pain, which worsens over time. And then you have the empowered healer, someone who's gone through the program and is willing to change. They're willing to reclaim their health. They've embraced the program and they're committed to sustainable change. The mindset, think of the word mindset. I deserve to feel healthy and vibrant. I'm willing to invest in myself. They believe that small, consistent actions can lead to long-lasting transformations. They follow the program step by step. They embrace the education, and they implement the functional medicine principles like nutrition, stress management, movement, and they are ready for any support that we can provide them. They work with us. So as an outcome, they end up being energized, feel free from chronic pain, experience clarity and focus in their daily lives. So they have a sense of control over their health. And their identity statement, I'm someone who takes charge of my health, and I create a life of energy, vitality, and joy. So you can type in the chat where you want to be. Do you want to be that person who is stuck in their ways, or are you ready for change? Do you want to change your life? Do you want to change your health? So please type what kind of person you would like to be in the chat.
Ready for change, Helen. Excellent.
Yeah.
That's why you're here.
Yeah, exactly. Exactly. We owe it to ourselves, take care of our bodies. Love it. Love it. Thank you for that.
Yeah.
Energetic and healthy. Thank you, Jeanette. It's so hard to break habits. Don't you worry, Thomas. We're going to come to that.
Absolutely. So if I may add something here from the identity perspective, hard to find time. Yeah, you see those limiting beliefs, those paradigms are already popping up, but we'll talk about that. So everything Grace just shared is why identity work matters, so profoundly. If you're living from the identity of the struggling survivor, you will keep repeating the same choices, the same habits, the same hard to find time, hard to break habits, hard to change, and the same exhaustion. But when you shift into the identity of the empowered healer, your decisions change, your thinking changes, right? Your decisions change, your discipline changes, your energy level changes, of course, and your results change. And this is where my work comes inside this program. I guide you through a transformational system designed to change the thinking patterns that drive your habits and shape your life. When your thinking shifts, your choices shift, and your entire well-being expands. And this is how full spectrum transformation actually happens. Confident, calm, not medical, not diagnosing, not treating anything. It's thinking. Your thinking, can change anything and everything. So I want everyone to lean in even more deeply. What you're about to hear is the blueprint that has transformed hundreds of lives. A blueprint rooted in clarity, truth, deep-rooted truth, and science, and the belief that your body is capable of extraordinary change when given the right conditions. Let's continue, Dr. Hula.
Okay, so I'm going to talk about, I'm going to share my slide, talk about some functional medicine principles.
The system to success.
Yes. Right, my iPad, come on, don't start now. Zarika, I think my iPad is frozen.
You want me to share your slides instead?
It's okay.
Yes, please. I turned it on right before. Yeah, just please share. It doesn't seem to be working. Okay, thank you. So the title of today's talk is really about our energy levels, a biochemical path to healing the gut, balancing hormones, and revitalizing mental health. And I'm here with Dr. Zoltan Nagy and Dr. Catalina Grija. So Dr. Zoltan is a consultant radiologist based in London, very extensive experience, and his done a lot of work as a full specialist registration, GMC, specializing in cross-section imaging, including body and musculoskeletal MRI and CT scans. He has extensive experience in oncology imaging, an active member of chest, urology, liver, and rheumatology multidisciplinary teams. He served as a consultant, CT and MRI lead at BH RUT NHS Hospital since 2006 and has held a parallel private practice at Spire, Roding, East London, and Eastgate Medical Centre, London. He is recipient of a Level 4 Clinical Excellence Award. So very prestigious, and we are honored to have him here with us. And Dr. Catalina is based in Chicago. She's an internal medicine doctor, but she's also functional practitioner and specializes in functional wellness. So next slide. Yeah, about my bio, I've had extensive experience of work as a GP, aesthetics, and functional medicine. So Rika, you can move on. So what's functional medicine? So it's catalyst in the transformation of healthcare. It treats the root causes of diseases and restores healthy function through a personalized patient experience. Next slide. So what's the difference between conventional and functional medicine? So conventional medicine is disease-oriented, doctor-centered. Everyone is treated similar, is specialized. Diagnosis is mainly based on symptoms. Functional medicine is holistic, health-oriented, patient-centered, looks at underlying cause of disease, the root causes, and treats everybody as a biochemical individual. Everyone is different. And it has a huge preventative approach. Next. So we manage a lot of chronic diseases through functional medicine. And I am in no way saying that conventional medicine is bad, but I am just saying there is a gap where functional medicine would fit in well, especially with prevention and even reversal of most of these chronic diseases listed here, like chronic fatigue, fibromyalgia, diabetes, high blood pressure, Crohn's, arthritis, help with menopause, andropause, many autoimmune conditions, and so on. Okay, next. So we do a lot of specialized tests, full blood tests, but more profiles than you would get from your normal doctor. Then we do comprehensive stool analysis to check your gut. We do epigenetics for DNA health check. We do organic acid tests to check for amino acid, vitamin, neurotransmitters, and mineral deficiencies. And then we do a complete hormone profile for both men and women, which includes cortisol levels. Next slide. So this is an example of how the tests look. As a GP, if you took these tests to me, I probably wouldn't know where to begin because we are not trained that way. But the first slide, if I can pinch over it, is a stool result analysis showing the microbiome. It tells you the good, the bad, and the ugly bacteria, the good being in the green, the bad in the yellow, and the extremely dangerous in the pink. And it also tells you whether you have yeast, whether you have parasites, and these are the things that are causing a lot of problems in our bodies. And then we also do the organic uric acid test, which I'll show you more in detail later. And we have the DNA health test, which tells you what types of genes you've inherited. In this person, for instance, their detoxification, they have a deletion. That means their liver doesn't detoxify well. And just carry on to the next slide. So before I go into this case study, I would just like to mention the 5 biggest mistakes people make with their health. Zarika, you can turn it off at this point. We'll come back to the case studies. the 5 biggest mistakes people make with their health, I think I already touched on it briefly, but it's things like ignoring sleep. If you're not sleeping well, people take it as, oh yeah, that sleep is unimportant, I can get on without it. It doesn't really matter. Eating too much processed foods or bad nutrition, eating a lot of sugar, and again, they just continue in that path and think, you know, it doesn't matter. The just convenience of eating processed foods outweighs the inconvenience of bad health, and they're not exercising enough. They're sitting too much, and we have sedentary lifestyles. If we don't make an effort, we will really be sedentary, and that has huge health consequences. Ignoring stress. So stress takes over and just keeps taking over, and stress causes 80% of our diseases, because when you mess with your cortisol levels, you mess with the other hormones as well, and you mess with your gut. And these are really the basics. If these systems are not working, the holistic approach comes in, where you have to look at one body system affecting the other body system as well. In the current conventional medicine we practice as a GP, you just look at one problem. But here we're trying to look at all the body systems together, because they work together. It makes sense that they work together. So neglecting your health, neglecting your gut health. So those are some of the mistakes people make. So I can go back to the case study, please. So in this case study, this is someone who did the stool analysis test. So the test kits get posted to your house. You do the tests from the convenience of your home. And we send the test kits to Nordic laboratories in Denmark. They come back to us with the results. And this person had a lot of parasites. And you can see 2 families. By the time you detect parasites in the stool sample, it means there is a lot of parasites. The knock-on effect, it's affected how their pancreas is working. You can see they have really low elastase. It's affected their inflammation in the gut. They have really high lysozyme. And their immune system, 70% resides in the gut. Again, is impaired. They have really low immune system because the immune system is trying to fight. So in this particular patient, we put them on the program and then gave them the protocol to deparasite, if I can use that word. And so they took supplements that made them basically kill the parasites. But the interesting thing is, when they passed stool, they couldn't see any parasites. However, when they spread out the stool with the plastic spoon, they were shocked. It was packed with parasites. So that's a powerful message. There's a lot going on in our bodies. So you think you're eating food, but you're feeding the parasites. As a result, when we did his organic uric acid test, he was deficient in almost all the nutrients. And I will show you that in a later slide as well, how it looks. So these are some of the examples of things that can happen if we don't take action. We have another patient who, a young boy actually, just 10 years old, had severe allergies. Anything he ate would turn into a puffy face, itchy body, swollen eyes, and this kept going on. They put him on cetirizine long term, and he wasn't getting better. So the parents approached me, and we did his stool test, his urine test, and his DNA test. And lo and behold, his gut was not working well. His urine test, the metabolomics test, showed he was deficient in 80% of nutrients: vitamin A, vitamin C, vitamin E, the Ds, vitamin glutathione. So we had to give him the correct supplements, pure clean supplements in high dose. And within 3 months, he managed to get off his cetirizine. He became more active and was eating, and his allergies had disappeared. So this is how powerful and impactful you can get with the functional studies and get into the root cause of problems. It always seems like it's magic because, 3 months and he had been suffering for like 5 years. So yeah, so I just wanted to share this example with you. So I'll hand you over to Dr. Catalina for now.
Amazing. Absolutely. This testing the protocols, the personalization of treatments comes from such deep training, right? And I think we can all acknowledge that Dr. Hula is profoundly committed to helping people reclaim their well-being. And I think all these people that regained their health, that had spent often thousands in consultation before, in testing, and months or years in being miserable and searching for the right answer. And after they find her, they acknowledge that the cost of not having found her earlier is like at least 10 times higher than her cohesive, effective system that gave them their life back. So just take that in for a moment. This is not about money. This is about life. Definitely. So, Dr. Hula, let's teach some structural parts of this program. What does that entail?
Yes. So the structural parts, again, back to the slides. So what normally happens when you come onto the program, we arrange for you to have the tests. And again, this is showing some of the tests that we do, the stool test. And Zarika, the next one, I'm just going to go through this quickly because I'm conscious of time. So these are the results telling you if you have the bad bacteria, what supplements you can take without taking antibiotics that will get rid of the bad bacteria and the fungi and the yeast. And this is the metabolic test telling you the deficiencies. And you can see this person is deficient in most things. And in the next slide, is also very, very deficient in a lot of things. Not the next, on the same slide, Sarika. Yeah, so anything in yellow or red, like literally deficient in everything. And you wonder why you have no energy. You wonder why things are not working well for you. You don't have the ingredients the body needs. The body needs these things in order for the body to work, for your energy, the mitochondria to work, for your other systems to work as well. So this is very common. I find this all the time in all the tests that I do, that people are severely deficient. They think they're eating and they're eating well, but if your gut is not absorbing, if you have parasites, then it's a lost cause. Okay. And then here's the hormone test. The hormone test details, like I've never seen this before, like from what makes your testosterone, your DHEA, down to what makes your estrogen, progesterone, and then it tells you their breakdown products, their levels, the enzymes involved, how it's broken down, how the liver metabolizes the estrogens, and the knock-on effect if the liver is not metabolizing enough estrogens out of the system. And everybody's result is different. In this particular case, actually, they started with really high levels of estrogen. They were trying to conceive. And you can see in the red, that's where how high the estrogen is. And after being on the program for 3 months, just 3 months, the estrogens normalized. They went back to green, to normal levels. And after 6 months, she was able to conceive naturally. And this is somebody who had been through infertility tests and failed twice. So again, this is how impactful this program is. And the DNA core tells you what type of nutrition is recommended for you. It tells you what your methylation, detoxification, inflammation is doing, your weight management, your exercise response. It's a very powerful information to have, your food intolerances. So if you know all this information, then you can work backwards to correct it. So I'd like to talk about one other case study. This is to do with stress. No, okay, this one is to do with the NHS doing tests for calprotectin, which is an inflammatory marker in the gut. And the NHS results showed normal levels, but when we did our tests, it showed they had high levels of calprotectin and other inflammatory markers as well. So this is just a quick slide to show you that your NHS results might be normal, but the type of tests we do are different. So you get different results. And if you don't take action over time, this is what becomes chronic disease, ulcerative colitis or Crohn's. And it just gives you, you know, an idea of where you can go with these tests. And the next slide, please. Okay, I think we'll take a break here and we'll hand over to Dr. Zoltan, who is the consultant radiologist.
Okay. Smoke. Might ask you how are you basically are you seeing my shared slides now?
Have we given you access to share?
Hold on. Apologize for this one.
Dr. Zoltan, you have to request it, or Dr. Grease, you can make him a co-host. That would
All right,
be
okay, I'm gonna make you a co-host. Okay, so I've made you a co-host. That should allow you to share your slides.
Okay. Okay, are you seeing now well?
Yes.
Okay, so so I've been working with MRI for quite a long time, since ever I finished business medical school for at least 26 years now. And I see, the MRI has evolved a lot. So originally MRI used to be like a single station, very specific examination for very specific purposes. But now as technology has allowed to evolve, now we are doing actually more and more body parts as part of a scan. As probably I mean, CT scan is one of the most conventional scanning nowadays to do actually larger scans, full body scans, which is a very quick tool, but unfortunately it uses a lot of radiation. So MRI, what you see on the picture, this is how, like, let's say like a general composition of whole body scan looks like. But I mean, this is more like a processed image. So MRI still uses conventional methods. We're doing still multiple body parts like a brain, spine, chest, abdomen, and pelvis. And we do a composite image, and we use it for the whole purposes of screening for specific indications. And that's where, the technology has evolved, because these scans can take a lot of time, but because there are like multiple accelerated examinations, like parallel imaging, that means there's a lot of also AI tool now being used in scanning. That means that patient can be scanned much, much quicker than before. Still, a whole body MRI can take quite a lot of time as well. And there's a lot of it's also still evolving field, because there are also kind of like low resolution kind of screening scans, but there are also high imaging, very focused one. So for example, just put into perspective, when we do a CT scan, usually by default, we can achieve the thinner slices. So that gives us a higher resolution. With MRI scan, the protocol has to specifically identify that how well we zoom into the body and how detailed the images are. So that makes the whole backbone of the whole body MRI, that what is the focus on? Is it just like general screening for looking at major pathologies? Are we looking for even the smallest possible lesions? Conventionally, whole body used to be like the tool of oncology, especially like hematology, myeloma screening. Then we can even detect a few millimeter small lesions. Obviously, these scans have limitations, like a spatial limitation. Around 2 to 3 millimeter, the very many small lesions become completely non-specific. But between 5 and 10 millimeter, the specificity grows bigger, and the lesions larger than 10 millimeter, the specificity dramatically increases. But now also MRI is being used for very high-risk patients with genetic actually predispositions, and can be used for on a regular basis, like a yearly basis, like a breast screening would. And then there's also the conventional method of, should the patient have a focus, maybe more like central nervous system imaging, like if there's neurofibromatosis, for example, in the family history or in the background, because then those images can focus more on the spine, whole spine, brain, and maybe the peripheral nerve roots. Or it can also basically tackle just like the bone marrow disease. So that's something. It's not just one whole body MRI. It's yes or no. There's a lot of things under one big umbrella, and it can be very complex. And also the implication then can be, there's also a financial factor as well that has to be taken into account. So what makes MRI unique? So first of all, we're doing like kind of basic anatomic imaging, which is conventionally so-called T2T2 weighted images. And then we're using something called the fat suppression technique, which completely, that's a very important factor, that we have to suppress the fat composition in the body, like in the liver, subcutaneous fat. Because what the fat does on MRI, it brings up as the same signal on this type of T2 weighted images, which is the best for looking at a high contrast soft tissue. So it suppresses the fat signal, and everything that's got a high water component, like edema, lesions with high extracellular component, would bring it up, would bright up a bit more. So, and also there's another technique, which is also the key, the backbone of whole body imaging, is so-called diffusion weighted images. Now, diffusion weighted images, I don't want to bore you with physics, but what it does basically, it detects if the molecules within the extracellular space are moving freely or not. So if there's a stroke, for example, there's a tumor, it all restricts the extracellular space, so the motor molecules don't diffuse as freely as they should. And this imaging basically catches all these features, which can be very tissue characteristic as well, because most pathologies, tumors, stroke, do have this feature. So that's what makes whole body imaging very much similar to PET scan. I think PET scan is still a bit more specific, especially if you're looking at very specific traces, but MRI as a screening tool does have similar capabilities. So how it works, that's one of the challenges. A typical scan can take from, maybe 45 minutes, but it can go up to 120 minutes, depending on how detailed do we want to screen and get involved. Obviously, so there's no such thing as, so something is short, there's also a penalty. If something is long, we can get better images, but the penalty, there's also a penalty, because patient might not tolerate it as long as we would like them. Imagine, I've been the MRI scanner myself before. I think even 30 minutes was enough for me, and many patients, and I'm not claustrophobic. It's more about you have to be still, because if you're not still, the MRI can compensate for a while, but after that the images degrade, so the quality does become reduced. Now, that also could be an approach that maybe, like a longer screening scan can be, broken up to smaller sections, like 2 45-minute sections, so the patient can relax and then go back to the scanner. If you want to include like the whole limbs, you can look at the images. Basically, the whole patient has to be covered with this kind of gauze. It's more like a radio wave device that we put in a radio. We excite the body with the radio waves, and we want to catch those actually signal as close as possible, so we can achieve the best images. As I said, it requires motion control, very good fat suppression, and the patient has to be really, really comfortable, so there's no movement artifacts. Unfortunately, these donut-shaped scanners still produce the best images. There are some open MR scanners available, but those are of lower quality because the magnetic field has to be at a certain level to achieve very good image quality. So there are lots of technical challenges as well, but these scanners are, as I said, getting faster and faster with new sequences getting introduced. We kind of moving into a territory where we can now do like a 3D block of images, so we don't have to repeat in different planes. We can just do one block and also reconstruct the body in different views, so we get the best out of it. So there are many clinical applications. I mean, these are just a few. I just wouldn't go into the whole detail that what we can detect, even without being very specifically focusing on a specific organ. Now there are some certain investigations that still not cannot be basically part of a whole screening, conventional screening, like cardiac imaging, for example, or breast imaging, or, for example, even lung. I mean, don't get me wrong, like cardiac and breast MRI is one of the best investigations, but these require very specific, even more additional time and contrast as well. Whole body scan doesn't use any contrast. These are plain scans, so the patient doesn't receive any injections. They can relax. They just have to, lay still. They can, and sometimes there's a noise, but it can be reduced. And patient can experience playing some music. So it can be also calmed down and provide a calm environment so we can best achieve the best imaging. I mean, for example, you can see it. I mean, this is a myeloma patient, for example, and you can see it's almost like a PET-style image that can be created, that all these bone marrow changes, unfortunately, are myelomatous lesions, and maybe just a few lymph nodes as well. So the MRI can be also used as a screening tool, also as a follow-up tool, staging tool, comparison, because it can also be looked at as certain biochemical components of the diffusion-emitted images. So it can also indicate if there's a response to therapy or not. Again, whole body MRI, I mean, it could be focused to musculoskeletal as well. That's also a problem. I know basically some, for example, some football clubs even basically do like a complete joint health scans for certain high-profile footballers, just to make sure basically that what they signing off is what they're getting. So basically, there's no injuries, what the outcome is. So there's a lot of implications, of such screenings. Obviously, I mean, for neurological comparison, MRI is the best for brain disease, atrophies, dementia screening, demyelination, every type of neurological conditions. And then, as for screening, it can be used for women. It has finding fibroids, adenomyosis, endometriomas. Very often, women basically go around for years with symptoms, non-specific symptoms, pain, abdominal, pelvic pain. MR is very, very sensitive, picking up even the smallest endometriomas ranging from 5 millimeter, because the breakdown product of methemoglobin basically brights up on these MRI scans. The breast screening is not really the MR territory. It's more a specific disease, but it can also detect incidental findings or major diseases. Very actually good otherwise for breast implants. Men's health, I mean, prostate is a specific investigation. I would say the whole body screening with a focused prostate views would be the best approach, because if combined with PSA, it can detect clinically significant tumors. Very small indolent ones might not be, but those are the ones that don't really need high attention, just more like active surveillance. Very actually common finding inguinal hernias, some incisional hernias, Spigelian hernias, all type of hernias can be detected on even just on a normal routine scanning without additional extra scanning. Urinary tract can detect. One basically disadvantage of MRI that it doesn't really see smaller stones, because the calcification is black on its by its nature, doesn't contain any water molecules. So that's one of the things where CT still much is the gold standard if the main focus is on kidney stone disease. And what MRI is really good is picking up all kind of inflammatory conditions I mentioned, even in the joints, like rheumatological diseases, SPA, sacroiliitis, but also for Crohn's disease, general colitis, cystitis, chronic cholecystitis. MRI would show all these, even if the patient doesn't have symptoms. Just another tell, for example, once we've done a whole body oncology scan on a hematology patient, and actually the patient, we picked up appendicitis, which was an acute appendicitis of the patient, and it was 1 week old. So even MRI would pick up all these pathologies very easily. Obviously, very good for looking at the whole lymph node map, if there's any reactive lymphadenopathy or pathological lymphadenopathy from head to the inguinal areas as well. Also very good tool for pyonephritis, very sensitive. Quite often we see patients coming with non-specific pains, and even urine test doesn't show anything, but MRI actually does show early pyonephritis. So it's a very, very powerful and sensitive tool for that as well. Not even mention diverticulosis, which can also lead to diverticulitis. It can be very easily picked up on just general screening as well, because it has a very specific pattern. Again, just an example of a patient that was scanned like a year ago for a whole body scan. I think it was just more like a chest, abdomen, pelvic scan, but it was more like non-specific back pain. But we picked up an incidental finding of a renal tumor. Now these renal tumors tend to go slowly, maybe over a few years. But you can see, I mean, the small lesion in the lower pole of the kidney, MR can keep very specific to indicating that this has a high degree of malignancy, and the patient was later operated on. It turned out to be a T1A RCC without any metastatic involvement, and it was basically curative on its own. So sometimes these incidental findings can be life-saving. Now, the thing with incidental findings, it can be also a menace as well, because many times we pick up, for example, adrenal gland adenomas very often, and then can cause a bit of anxiety, might need to follow up. Small lesions in the liver could be picked up. But I would say that, if there's a baseline scan, and then if everything settles, that there's no concerning finding, having a baseline scan is also a good approach for further scan, because if there's a further scan performed in the future and there's a difference that can be seen to a baseline scan, it can save a lot of time on follow-ups in the long term, or also acting on something that is actively growing and needs to be rather than followed up. So if you follow up a small lesion, let's say 3 months later or 6 months later, there's a high chance that it could be a small tumor. But obviously for certain capacity issues, we can just biopsy everyone with the small lesions. But if we got a baseline and we compare to 1 or 2 years back, we can easily determine that this is a benign condition, or does it actually need more focus. Now, there's also some kind of approaches to how to basically handle cancer screening. I mean, these were like some of the recent articles that approaches. Now, in radiology, if we find a scan incidental finding, we tend to now put it into 5 categories, like from thyroid glands to breast to kidneys, ovaries, prostate, everything. Basically, almost everything is that one. 1 to 2 usually means it's a very low risk, so we don't really have to worry that much about it. 1 actually means that it's certainly benign. 2 means mostly benign. 3 is the territory which says intermediate. So these are the lesions that need usually follow-up. But again, we have to take into risk about what is the patient's background, lifestyle. Has the patient been, for example, a smoker, family history of cancer? And if there's a high risk population, like with certain gene mutations, the intermediate finding doesn't definitely need active follow-up on a regular basis. With the general population, maybe the intervals can be more relaxed. This is again a highly evolving field. That what is the cost and benefit ratio of doing these kind of follow-ups depending on, and obviously, if it comes to 4 and 5 categories, especially in the high-risk population patient, these require very immediate intervention, biopsies, and MDT approaches. Okay, so a bit of application in the short summary. So the whole body MRI is really good for screening, for cancer screening. And again, I think it can be tailored to specific needs. For example, in BRCA gene mutations or Li-Fraumeni syndromes, we know exactly what type of cancers are we looking. So maybe they could give a bit of more focus. So the whole body protocol could be adjusted to give a bit of more focus on those areas. It can be used as a staging and follow-up scan overall for cancer patients. Now, there's still, I will just do a comparison later, how does it relate to PET scan? But there's also, it can be used for genetically predisposed condition screening. The main difference, and I will mention it also later, that MR basically is a bionegative scan. It doesn't require radiation. It doesn't harm the DNA. So it can be safely used even in pregnant patients. Now, there's been a debate for many, many years about pregnant patients, but MR is also very safe in pregnancy as well. And there has been basically no real evidence that any harm has ever come from an MRI scan for pregnant patients as well. So, and this is basically also, the tool of pregnant patients that use nowadays. Also, whole body MRIs can be also basically maybe to be neovascular. We can do non-contrast vascular scans for the brain, carotids, arteries, peripheral, the SMA origins, celiac trunk, renal arteries as well. And actually, sometimes they perform as good or even better than contrast scans. So the patient don't have to worry about contrast, some nephrotoxic effects, or any other allergic reactions. And it can be also used for inflammatory focus search. When we know there's something going on in the body, but we can't find. It won't cover all cases, like for example endocarditis, but it would be very good for checking general inflammatory foci in the head and neck area, mediastinum, pelvic areas, liver, and all the body basically. It can be used as if there's a general health concern for checkup with the right indication. Obviously, just you have to to be able to manage the incidental findings. So the advantage is there's no ionizing radiation. As I said, it can be repeated many times. Obviously, there's a cost implication to that, and also a time and capacity issue. So it can be used for as I said, high risk patients for which is certain genetic conditions on a yearly basis. That's the recommendation. It's very good for checking bone marrow, and soft tissues equally. So any process, any hematological disease that affects the bone marrow can be very easily seen. Sometimes it's non-specific if someone has been a long-term smoker, because the red bone marrow reconversion sometimes can look like any underlying myeloproliferative diseases. But with the right combination of blood tests, these can be also checked. And that's very often the case that sometimes we indicate based on a bone marrow finding to do additional blood tests to ensure that which way the bone marrow changes actually lead. As I said, it's very superior in soft tissue contrast, very sensitive for bone marrow diseases, and an excellent tool for longitudinal follow-up. Now, it still has some limitations and disadvantages. Certain scans still perform better for very specific lesion characterization, like in the thyroid glands. Ultrasound is still the best method for that one. Now, for breast screening, MRI is not recommended as general. There are still, established better methods. Testicular scans is as good as, I would say, as ultrasound. Lung scans, MR does catch up a bit, but we still, in the UK, we got also some lung screening tools. So CT is still the choice of high-risk lung cancer patients with high smoking history, because that would even pick up even the smallest ground glass changes and very small nodules. MR would detect lung nodules, but it would have to be over a certain size. So it can be used as part of a whole body screening, but it wouldn't be the 100% best accurate tool for that. Obviously for skin and cervix and then small lesions, like larynx, very superficial small cancers, and in the GI tract, endoscopy is still the gold standard. MR is used for staging, or it would pick up incidental larger lesions, might not pick up few millimeter lesions, but would certainly would perform above 1 centimeter, especially above 2 centimeter lesions would be picked up easily. And that's where the whole body scan comes in. So when we do the scans, focus, that's a general approach, has to be applied. So the patients benefit the most out of the scan, and we focus maybe on some of the areas with higher resolution where the expected pathology is. So this is an example from certain provider. These scans can be provided as a package approach, for example. You can see, the time varies, quite significantly as well, and also what the patient is capable of. Very elderly patients might not be able to, tolerate these very lengthy times. Okay, and in comparison, PET-CT is still a very, very good and sensitive method, actually, for checking and screening cancer patients. It's a very good tool if someone has already been diagnosed with cancer and can be used for follow-up. It requires radioactive tracer injection and a CT scan, so you can imagine this is a very high radiation dose, especially if patients undergo multiple. So even CTs and PET scans themselves can introduce secondary cancers. That's known in the literature. So that's why PET scan is never actually recommended as a screening tool. It's more like an active cancer management and follow-up tool. Again, whole body CT scan can be very good for certain conditions. Again, very high radiation, even with the newest techniques when we're reducing the radiation, it still can be, a burden, and definitely not for the whole body. It is at the moment used as a screening tool for lung screening for high resolution patients. And now there's also a cost implication. You can see some kind of, these are actually pound figures, what, such a scan would cost, and obviously there are financial and capacity limitations when we're talking about screening, about cost and benefit approach, and also you would have to also consider the additional cost of the spin-off findings when it's indeed a benign finding, but we have to make sure that what we find is indeed benign and not a malignant one. So in conclusion, this is an evolving field, whole body MRI. It's been available for some time, but it gets better and better. We can be more specific, more focused, and go down to more detailed levels to pick up even the smallest lesion. It can be, my recommendation would be just rather than doing just a general whole body scan, be a bit more patient and pathology and family history specific. So the whole body scan screening can be focused on more of the risk areas. It's ideal for follow-up, as I said, because it's radiation free and has a very strong diagnostic performance. And not all providers scanners are the same. So also you have to be aware that what are you getting. So shopping around is very helpful. And also what's very important, that patient expectation have to be managed. Like in every screening, that patients sometimes expect that one scan would tell them everything, but it's never the case. And unfortunately, in medicine, it's always a combination of imaging, maybe even additional imaging, combination of blood tests, patient history, and the good old physical examination. Thank you very much.
Thank you, Dr. Nagy. There is a question in the chat about having full body MRI if someone has metal in their body, and how often do you recommend a full body scan to be done as a preventive measure?
So metal, we always basically have to check what type of metal is it. And unfortunately, most of the implants and then surgical clips are titanium based. So they mean they just locally distort the area. So even if someone had a hip replacement, we can safely do it. Now, sometimes the problems when there are some very old implants or shrapnels in the body, that can be a limiting factor. because what happens that these, but these have to be ferromagnetic, especially steel, has to be very, very carefully evaluated. Because, and for example, like major centers, like we do have an MR physicist, so they can evaluate the risk. Risk is overheating and movement of these kind of, but for example, stents, cardiac valve, metallic replacements are not an issue. Aneurysm clips are not an issue if they're made of titanium. Many pacemakers nowadays are being made of MR compatible. There are lots of other devices like hydrocephalus valves. I mean, they can be managed very easily. But again, some patients, unfortunately, would be excluded from MRI. But I think those are less and less because of the awareness of the issue. So even anyone, basically just titanium. Don't recommend anything else for replacement or surgical clips or anything else. Yeah, for screening, as every screening, is a debate, pros and cons. At the moment, breast screening is done every 3 years. I think this is due to that's insufficient. Cancers can develop in a very short time as well. A yearly basis, I think, would be the gold standard for many screening applications. 3 years is too long, even 2 years, I would say, because yes, we could pick up certain things, but then the whole point of screening that to catch things at an earlier stage.
Perfect. Thank you so much. Thank you so much. That was an amazing presentation. So if anyone has any other questions, keep them, and we'll have a question and answer at the end, and we're happy to answer more questions. But as Dr. Hula and Dr. Nagy just showed you the system, the testing, the science, everything, the steps that are included here, I'd like to add one essential layer that makes this system truly powerful, because it takes more than following a plan to change a life, right? It takes becoming the version of you who follows the plan, because real change doesn't start in your habits. It starts in your thinking. When we think the same thoughts, we make the same choices, then we live the same day, we have the same results for years and years. And I heard it said, do you want to live 1 year 99 times, or you live 99 years? Definitely, I want the different ones, progressive, right? So inside the program, can you hear me well? Yeah, okay. Inside the program, my role is to guide you through this transformational identity process, a process that helps you shift your thinking patterns so that you feel differently, you take different actions, your habits shift, your behavior shift, and absolutely your results will shift. This is how you create your dream life. You design it, you build it across health and well-being, relationships, vocation, time freedom, and financial freedom. When your thinking expands, your life expands, your well-being expands. You open doors that you did not ever think of that would be possible. And your full spectrum health is definitely possible once you change your thinking. Because somebody was asking earlier, how can I change my habits? It's so hard. By changing your thinking. And there's a science-based, proven, reliable system that I teach that takes you through steps and tools to change your thinking pattern and to become so much more aware of what's happening around you and within you. And when you have all those tools, everything changes. So it's almost like life from inside out. So if you would be ready for something like that, if you feel that definitely the core of change is in your thinking, type shift in the chat. So let me share little story here. We all know the phrase, the fly on the wall, like someone who sees what you cannot see, others cannot see. So when you're inside your own life, your own patterns, your own habits, you can't see the thoughts that are running you. But as a coach, I'm the fly on the wall for your thinking. And I help you see the beliefs and the patterns that drive your choices and help you rewrite them, notice them, become aware of them, and rewrite them. This is why identity work is essential, and you can't change what you can't see. So let's talk honestly right now for a moment, because about right now, some thoughts are beginning to surface, I'm sure. Will this work for me? I've tried everything. What if I fail again? I don't trust myself. I'm so tired. I don't have time to even think. If this is you, just take a deep breath with me. These thoughts are not truths. They're protective patterns. They are lies that want to keep you, pull you back in the comfort zone, meaning no change. So why don't we reframe those? So if you're thinking, I've tried everything, well, you've tried everything that you knew of, that you were aware of, and alone, or not with the right mentor. This time you're not doing it alone. You know how if you wanted to climb Mount Everest, you wouldn't just read a book and apply what it's written in the book. You would want to have the person with you that climbed Mount Everest and shows you the way and the dangers and exactly what to do to make sure that you're successful. Maybe you're thinking, I don't trust myself. Well, you don't trust your old identity, your old thinking patterns. Those thinking patterns brought you to the life you have right now. But let's change that. Let's change that identity so that you become who you want to be. I don't want to fail again. Well, nobody has ever succeeded without failing in something, right? Think about Edison. He didn't fail 9,999 times to, invent the light bulb. He just found ways that it didn't work. You're afraid of failing without support. Maybe you're thinking like, oh, is this really possible for me? I'm too young, I'm too old, it's too far out, whatever it is. If transformation wasn't possible for you, you would still not be here. You wouldn't still be here listening. So it's definitely for you. You think these objections and they're normal. It's your fear-based identity. But they simply show you that you are on the edge of growth. Let's hear from one patient who said, I have tried everything and was wondering if this is possible. Let's roll that testimonial. Let's unmute Sal.
Sorry, guys, I was muted. Hello, everyone. How are you? Hi.
Welcome.
So much. Thank you so much. I'm just going to move to a different area. One second. So my transformational moment was when I was struggling with fatigue. I'm a salon owner. I was literally going through menopause and everything was against me. My weight had increased a lot, and I decided to try out the functional healing because I felt like I was so sluggish all the time, like I was eating, but the foods weren't right. And this was something that really, really appeals to me because I felt like it had changed my life. Right now, I feel like a real woman. I feel like I'm healthy. I feel like I've got my life back. And I feel like I can focus. The clarity is back again. But before I tried functional healing, I just always felt like my stomach wasn't working properly. My gut wasn't, anything I ate, I ended up with a bloated tummy. And I just felt like there was something wrong. And I turned to Dr. Grace Hula for help, and she transforms lives, one person at a time. So this is my testimonial of how I felt that this changed me. Thank you.
Amazing, amazing. We want definitely everyone here to have a testimonial like this in a few months. And we're happy to help everyone get there because everything is possible. I totally believe that. So Dr. Hula will be sharing the next step soon. And for now, just notice your future self is pulling you forward already. Grace, handing back to you.
Yes, thank you so much. I'm really loving the stories, and I'm really loving how you've moved this, and you're changing our lives. I just wanted to just briefly talk about insulin resistance and its role in creating so many diseases. And Zarika, if you move to the next slide, please. So when we eat, you spike your blood sugar levels. So the more often you eat, the more often your blood sugar levels are spiked. So if you have one meal, after about 2 to 4 hours, depending on the type of meal, your blood sugar levels will start to go down. But each time you eat, you spike your blood sugar and you spike your insulin levels. Over time, you develop insulin resistance. And when you develop insulin resistance, in the long run, you end up with several other health conditions, like in the previous slide. Zarika? So when you eat carbohydrate foods, your blood sugar spikes up so high. When you eat protein foods, it's not so high. And when you eat fats, it's even lower. So what happens is when you eat more carbohydrates, you end up with constant high sugar levels and constant high insulin levels. And in the long run, there's so many diseases that come out of insulin resistance. And Zarika, if you go back to the other slide, not that one, previous. So these are the conditions you can't get. And these are easy problems to resolve. You can have heart disease, obesity, migraines, dementia, osteoarthritis, childhood obesity, PCOS, fatty liver, arthritis, Alzheimer's, erectile dysfunction, sarcopenia, high blood pressure, type 2 diabetes. All these are based on insulin resistance. And what you can do when you come to us, we teach you how to avoid getting insulin resistance by giving you a personalized program. And the way we do the personalized program is by taking a thorough history and doing assessments, and then we do the tests. And when we build the tests, that tells us how your body is working. And when we know how your body is working, we come up with a personalized program for you. And these medical tests, they help us to explain what's causing the problem. And then we make a step-by-step plan for better sleep, less stress, easier digestion. We fix the deeper issues. And this is what helps in the long run. So you focus on the basics: eating well, moving well, sleeping well, managing stress and environment. And then we supplement if needed. And usually with your test results, we're able to see where the problem is going on. And then we do regular assessments to come to the root cause of the problem, and we layer it out so that you get real changes, not just a quick, easy fix. So as we said, quick habits can change fast, but deeper things like stress or how your brain reacts take longer. Changing just one thing isn't enough because everything in your life is connected. So you have to do things step by step. And to get permanent change, you have to go deeper. Temporary change only fixes things on the surface. Permanent changes turn habits into things that are more permanent. Like when you make a permanent change, that's it, you've solved the problem. Temporary ones takes effort, is a complete waste of time. Permanent changes fix the real problem. So here again, our focus is really on fixing the real problem. But in the functional medicine blueprint, it's a personalized plan. It's genuine for everybody. It's holistic, and there are frequent and regular assessments. And I can assure you, it's a life-changing process. So I'm going to hand you back to Dr. Catalina.
Absolutely.
I just wanted to mention about the insulin resistance because it's at the heart of everything we do.
It is, because it's such a widespread issue these days. And I think everybody's looking for a way to lose weight. And they don't think actually on the right mechanism to do that. And they take, lots of medications, and they don't always obtain what they wanted to, or it's really temporary, like you said. Absolutely. What do you think about those people that say, oh, I don't have time? What if my, significant other says no? It feels expensive, although we haven't even talked about any price yet. I'm already trying to something else, or I've tried something else, or I did so good just 18 months ago, like Helen, and I think it's too late for me. What would you say to those people that come up with those limiting beliefs?
Again, it's better late than never. So the sooner you start, the quicker you get the change. Otherwise, you're stuck in this rat race where nothing changes. You're going on the decline. You're traveling on a fast roller coaster that's just going downhill. It's time to make change. It's time to be proactive. And it's only you that can make this change. I don't have time. Anybody can say that. It's too expensive. Anybody. Too expensive. Like, what price would you put on your health? If somebody asks you, I want to pay for your life, what price would you put for your health? Would you say, oh, it's too expensive? No. If somebody told you you had cancer and you were dying and they had a solution, would you say it's too expensive, or would you try and get the money from anywhere at whatever cost? So you need to be thinking along those terms, because with functional medicine, you can reverse a lot of medical conditions and prevent the ones that have not even started, because you can look at a cellular level 5 to 10 years before big guns develop. So that would be my message to them. And I think before I hand you back over, Zorika, can you play Anne's video, another testimonial, and then that will be the last one, I promise. I just get carried away with them because I like to hear stories of success.
Sure, 1 second, please.
Hi, I'm Anne, and I've been with Dr. Grace for nearly a year. Hi, I'm Anne, and I've been with Dr. Grace for nearly a year now. I first made contact with her because I worked out that I wasn't absorbing my vitamins and minerals properly, despite eating a good diet with lots of vegetables. This was down to a drug called famotidine, which I was taking for gastric reflux. Most people lose gastric acid as they get older, and this medication reduced my low level even further. Following a strict diet and taking lots of supplements, I've been able to stop the harmful famotidine. I take a gastric acid supplement and have hardly any reflux symptoms now. I can also report hardly ever having a headache nowadays, and I've lost a stone in weight, which was very, very welcome. I am what they would call a work in progress, but I'm continuing the regime to see further improvements in other areas of my health. I would recommend Dr. Grace for her passion to see people become as healthy as they can be, and for her kindness and care to us as individuals. She also encourages us to address other areas of our lives, reducing stress with meditation, sleep hygiene, and a positive and grateful attitude to life.
Super. So everybody's happy, you see. That's the purpose. Everybody to be healthy and happy. Definitely. And I think the cost of everything, it's the cost of not doing it. You know, I think if people would think that way, then they would definitely invest much more in themselves, in their health, than, you know, otherwise. And so before we move forward, I just want you to imagine something like with crystal clear honesty. Imagine knowing exactly what's happening inside your body. Not guessing, not Googling, not worrying, because you've had a full set of advanced tests that shows precisely what needs support before it becomes a problem. Imagine having a personalized roadmap that saves you time, energy, and removes the chaos of trial and error. Imagine learning lifelong tools that help you understand your thinking patterns, why you self-sabotage, why you repeat certain habits, and how to shift those patterns so your actions finally match your goals. Imagine you feel in control because your mind is clearer and your boundaries are stronger. Imagine your relationships improving because you're no longer showing up from fatigue or fear, but from emotional stability. Imagine having more time. For those of you who wonder if I have time, just because your energy is stable, you're organized, your thinking is organized, and you are focused. Imagine having financial freedom because clarity and confidence return, and you make bold, aligned decisions again. Imagine having a body you trust, a mind that supports you, and a life that feels like it finally fits. This is what becomes possible when you combine advanced testing, a structured well-being system, and transformational identity work. This is the life waiting on the other side of this decision. We are one decision away from anything better in our lives. And this is literally a way from transforming your life. So this program gives you advanced medical grade testing, personalized well-being strategies, identity and mindset tools, emotional behavioral support, accountability and structure like you've never had before, and deep transformation. You stop guessing, you stop doing this alone, stop starting over. It's trying different things, throwing spaghetti at the wall. And the result is a healthier body, clearer mind, and a life that finally works. One important note, I know that not everybody is here, but we work so closely with everybody that we only take 10 patients, 10 clients at a time, just 10. So once those 10 spaces are filled, we close enrollment until this space opens up again. So if your heart is saying, yes, this is for me, please listen to that nudge. It's guiding you. So if you're ready for real change, if you're tired of doing it alone, if you want structure, clarity, support, you want to have that time and energy and real freedom, and you're ready to invest in yourself and in your future, you're in the right space. This is not for those who want a quick fix, or not ready to change, not coachable, they're not ready to look at their habits and to expect results without participation. This is for people who are ready to grow into the next version of themselves. So at this point, most of you, that's so cute, puppy. Most of you know by now whether this resonates, right? I felt the possibility, and in a moment, Grace will walk you through what the next step would be and how you can explore joining us. And so if you feel that inner voice saying yes, listen to it. Don't send it to voicemail, so to speak. Honor it. Grace, over to you.
Thank you. Beautifully said, Dr. Catalina. You're very inspiring. So to proceed, if you want to work with us, we have some really special packages. The package we have, you can do 5 comprehensive functional lab tests: the gut test, the urine test, the DNA test, the hormone test, and the blood test. You have bi-weekly one-on-one consultations with myself or with Dr. Catalina. You have full body MRI in the package, Dream Builder, which is what Dr. Catalina provides with the mindset, how to change your mindset, how to change your habits, and how to change your life. We offer weight loss management. We offer True Check, which checks for 70 different cancers. So you prepare yourself, you don't wait for something to happen, you are proactive. We have a personalized nutrition and conditioning plan, which comes out of the tests you've done and from lifestyle. We have weekly group calls. We have stress management strategies, and we have lifetime access to our digital library of video recordings, teachings, education. So if you would like to join us, we're going to post a link where you can book on a follow-up consultation with myself, a discovery call. And if you book within 48 hours and you come onto the program, you'll get 10% off. But this is only if you jump onto the program within the next 48 hours. As you can see all along, this is a life game-changing program to have. If you want to live a long, healthy, happy, fulfilled life, this is the route to go. This is how you have to do it. So book a call.
Thank you, Grace.
And help is on the way.
Thank you. Thank you. Yeah. And, the call is just for you, to discover if this is a good fit, if this would work for you, and what's possible. But that's an extraordinary breakdown of what's, included in the program. And we want to open it up to some questions right now. But before we begin, I want to set up one important boundary so that we keep everyone safe. We cannot answer personal medical questions, interpret symptoms, or give any medical advice today, but can answer questions about the program, about the experience, transformation, and about whether it may be the right fit for you, even before going on the call to discover your dream. So if you have a question that falls into these categories, pop it in the chat right now. Anybody, any questions?
I think we skipped 2 questions. One for Zoltan asking about how many Tesla's MRI machine in your facility have. And another one, I think someone was with ADHD asking if the program is suitable for them.
Yeah, so it's a 1.5 Tesla MRI scanner, which is the ideal. There are some higher field scanners, the other 3 Tesla ones available, but that also causes more artifacts and more problematic with metallic artifacts. 1.5 is a sweet spot for fast scanning. Yeah, so that's what we can offer.
Dr. Grace, I think someone was asking about help for ADHD.
Oh, yes. Part of this package, the blueprint with the lab tests, they help a lot to balance. We have patients who have ADHD, and most times, actually, it's really starting in the gut. They have a leaky gut, a lot of parasites, a lot of fungus, yeast. And once we clear that and we stabilize the blood sugars, it's almost like you've totally reversed the ADHD. So totally able to help you with that.
Mm-hmm.
A lot of autistic children as well, we see. And again, it's really parasites, yeasts, and they end up really nutritionally deficient in everything.
Wow.
Like everything. So I don't mean to be the sad news bringer. I'm sounding like that, but it's really true. These are the kind of results we get. These are the things we get. But the good news is we're able to fix these things within a relatively short time. Usually 3 to 6 months, you get 80 to 90% improvement. And with time, we teach them educate how to then keep going and make it a permanent change. So there's a lot of mindset training with it as well.
Yeah, and with the mindset build, the thinking patterns change. A lot of, again, old identity thinking and possibilities and judgments. And we don't know. It's interesting that with this program, you discover things that you were not even maybe thinking of, or you're fixing things that you didn't even come here for. But that is possible with the functional medicine and with the proper mindset work. So, yeah, I don't know about Dr. Nagy, but probably with doing the MRI, you would see him. But with Dr. Hula and myself, yes, absolutely. And that would be online for me, absolutely,
yeah.
Evidently.
Yeah. We're not flying to Chicago. Yes.
You're welcome if you want to. It's a beautiful city.
One day we will as well. Yes. So the MRI full body scan is part of the package as well. So you would be seeing Dr. Nagy or some other consultants within the Eastgate community as well. So Helen says, the annoying part is that I got on top of my nutrition and health needs about 18 months ago, and then I let it slide again. And it's just like the climbing Mount Everest story. You try it yourself, you try again, but if you try it with somebody who has already helped other people and who is trained and has the experience to do it, then you're more likely to succeed permanently. Because part of the program is education on how not to fall back into the habits.
Yeah, and literally changing those thinking patterns. Because we don't know what we don't know. And the moment you become aware of certain things and how some limiting belief that somebody put in you or you learn through experience, how that is limiting your life or sabotaging you, you're able to control it. And that gives you the tools for life. Obviously, you have access to it, all the materials for life. So you do this program once, and you're done forever.
Yeah.
You know exactly what to do forever. And then you know what to do for others, maybe your family, your significant others. You will be able to support them. And it's a expanding influence. It's not just you that change, but everyone around you will change. Everyone around you will change. And it's wonderful because we want to impact lives. And the more, the better.
Yeah. Yeah. Interesting about the ADHD. Helen says, I've a couple of friends with this on some heavy duty meds. Seriously, they don't need to be on the heavy duty meds. And the heavy duty meds have side effects. So you end up with a vicious cycle. You're not looking at the root cause, and yet you're poisoning your body with more and more drugs. These are heavy duty drugs, as you said.
Yeah.
They have heavy duty side effects.
Yeah, they are getting side effects from them. So it'd be good to kind of point them in the direction of other more holistic ways of dealing with it.
Yeah. Because what we give is natural supplements, good, high quality, well clinical researched supplements that they take naturally. And most times, to be honest, it's the things that I said, the gut health, having a leaky gut, having insulin resistance. Once you balance all these things, the ADHD settles down. Okay, I think it's time to wind up. It was coming to 2 hours. We said we'd keep it to not above 2 hours. So thank you, everybody. The link is below. I think Zorika posted it. You can book a consultation directly with me, but all three of us will be in touch, and we'll be working together to help sort out health issues. So click the link, copy it, save it, but try and book within the first 48 hours because you then get 10% of discount.
Absolutely. And just remember that you didn't sign up for this masterclass by accident. You came here because something in you, in your heart, in your life was asking for a shift. Life, body, mind, more mind path. And the truth is your future self already kind of knows the right decision for you.
Yeah.
So ask your future self, what should I do? So whether you choose to join the program or not, you know, we want to honor that part of you who wants more and knows you're capable of more. So if today's, you know, did speak to you, if you felt like a yes, then we would love to support you personally, not just for a month for a quick fix, but for the whole life, basically. You're not doing anything else. It's the one thing that fixes everything for you. And we'll invite you to book your consultation with Dr. Hula and explore whether this is the right next step for you.
And I'd like to thank Dr. Nagy as well for taking your time. I know you're a very busy hospital consultant, and I never remembered, I've not forgotten those days. Thank you so much for giving us 2 hours. I know that is a lot.
Thank you for giving the opportunity just to present it.
Thank you. Thank you so much. And Dr. Catalina, thank you so much as well. It's just been a pleasure listening to your inspiring stories.
My pleasure. Thank you.
Thank you. Thank you, everybody. Thank you, Zorika, for being the IT person behind the scene. Thank you, Babu, for organizing and helping. Thank you, Shanette, for the testimonial. I don't want to leave anybody out. Thank you, Helen. Thank you, Peter. Thank you, Zoya, Thomas, Flo. Thank you for attending.
Thank you, everyone.
Hopefully we'll see you all again soon. Okay, good night.
Bye, everyone.
Bye.
Bye. Thank you. Thank you.